Hi, and welcome to the Navigating Neurodiversity podcast. I'm Vivien, registered psychologist, and today we're very happy to have with us Dr. Poon Shi-Hui. Dr. Poon is medical director and consultant psychiatrist at Neuropsychiatry Associates, and besides her medical practice, Dr. Poon is also adjunct assistant professor at the Duke NUS Medical School, and I will link Dr. Poon's full bio down in the caption below. Welcome, Dr. Poon. Thanks for coming. Yes. So before we go into our topic, I just wanted to ask Dr. Poon, so aside from among all the medical areas that you could have specialized in, why psychiatry?
I actually entered medical school wanting to do psychiatry.
Ah.
Yeah, so I actually enjoy the holistic care. And sometimes, especially in psychiatry, you not only help the patient, you help the family as well. And I really enjoy that. And then, through the training, I realized that, there's a lot of neuroscience research going on that actually gives a biological basis to a lot of these psychological afflictions that we see. And I found it really, really exciting to link the two together.
Oh, fantastic. So you're one of those who went in, you knew already. It wasn't deciding what to do. Okay, great. So today, Dr. Poon and I wanted to talk about ADHD, which is one of the most common neurodevelopmental conditions that we see in our practice, especially among children and youth. So in this age of social media, we realize that there is a lot of information out there, and equally, there's also some misinformation out there. So we hope to provide you with some accurate and reliable information for our viewers, and maybe along the way debunk some of the common myths and misconceptions about ADHD as well. Okay, so we start with the basic. So, ADHD presents differently, right, in different individuals. So perhaps we can first talk a bit about the different presentations of ADHD that you see.
Okay, so the usual presentations are, we would three according to the treatment guidelines, the diagnostic guidelines, So we have ADHD inattentive subtype, where they present with inattentiveness, easy distractibility, forgetfulness. So these are some of the common ones. And then we have ADHD hyperactive impulsive subtype, where they tend to be more hyperactive both physically, they run around the place, very active. Sometimes it could be verbal hyperactivity as well, where they are very talkative. Sometimes emotional, where they have a lot of emotional dysregulation, a lot of mood swings. And together with that, impulsivity.
Yes.
Yeah. And also we have the combined subtype where they have both the inattentive and the hyperactive impulsivity symptoms.
That's right. So there's sometimes, parents come in saying that, I don't think it's ADHD because my child is not really hyper. And, and then actually it's good for parents to be aware that there is this inattentive presentation as well. Yeah.
And usually the inattentive subtypes actually don't really get picked up. Because they really don't pose any problems.
Yeah, so they are quite quiet, they're sitting in class, but actually their mind they may not be engaged
Correct.
in the lessons. Yeah. So there's also a lot of talk recently about ADHD in girls, right? How it presents differently. Share with us a bit about what you've seen.
I think I'm glad that there's increased awareness for ADHD in girls, because girls tend to mask their symptoms better, and their presentations sometimes are also a little bit different from what we see usually.
Yeah.
So a lot of times, of course, a lot of times they're more inattentive. So they tend to drift off or daydream. But in terms of the disorganization and being very messy, sometimes we may not see that in girls. Because they sometimes, make up for it by being overly conscientious or, very particular and meticulous about things. So that sometimes get missed out. But a lot of times, what I see in girls are that they tend to have more emotional struggles compared to their peers.
Yeah. So
a lot of times they may say that they struggle to stay afloat. Even if they do well in school, they may say that they feel like an imposter, they feel like their achievements are not what they deserve.
Yeah.
Some of them may have anxiety as well. And there's also this entity called rejection sensitivity dysphoria, where they tend to get a little bit more sensitive to perceived criticisms, sometimes not directed at them, but they just tend to be more sensitive, and that affects their mood.
Yeah, absolutely. I mean, we see a lot of RSD here as well, even with the younger children. So, when they're doing the right thing and the parent is just correcting, and then they really take it very personally, and the emotional reaction can be quite great. So I think that piece about emotional regulation is also quite important, that it is present in a lot of children with ADHD, even though technically it's not within the diagnostic criteria, right? But clinically it's something that we see very often, and sometimes when parents bring the child in, that could be the primary concern, that my child just find it very hard to manage and control their emotions and having meltdowns and things like that. Yeah. Okay, so Sharon, maybe you can share with us, talk us through the process of how you go about diagnosing ADHD.
So usually I would get the patient in together with the parents. So I'll be interviewing them separately. So get some feedback from the parents about what they think about the child's behavior at home and in other settings. And also to find out from the child or teenager what are some of the struggles that they experience. Sometimes to make it like, if the parents are agreeable, we actually do get feedback from the teachers as well to see if they actually have any difficulties with school and, according to these difficulties, if they fulfill the criteria in the DSM-5, which is the diagnostic criteria that we use for the diagnosis of ADHD.
Yes, that's right. Yeah. So I think, I don't know whether you see that in your practice, but when I work with clients, sometimes there's a little bit of confusion with, with where parents they might ask us like, why are you asking me all these questions? Like, why didn't you just see my child and things like that? So I try to explain to them that yes, we'll be seeing your child, of course, but it's important for us because when diagnosing ADHD, actually parents are a critical source of information in terms of their developmental history and the symptoms that they're presented with, right? Yeah. And are there any sort of things that you have to look into in terms of rule outs and differential diagnosis and all that?
Yes, for sure. So sometimes the individual may present with, they may fulfill the criteria for ADHD, but we still need to rule out certain medical conditions that can potentially present with similar symptoms. Most commonly, it could be like sleep disorders. So basically, sometimes insufficient sleep, you can be tired the next day, it can affect your focus. Sometimes a lot of kids with allergic rhinitis, right? They have runny nose and blocked nose. So that actually affects their sleep at night as well, even though they appear to be sleeping through the night. And that itself, if untreated, can actually present with symptoms of ADHD.
Absolutely.
And for some kids, they may have some sleep disordered breathing. For example, obstructive sleep apnea, like kids with enlarged tonsils or adenoids. So that obstructs the flow of oxygen to their body as well in the night, and that actually affects the quality of their sleep and also affects the attention the next day. And sometimes they may compensate for the lack of focus with hyperactivity, and so they tend to be a little bit more fidgety and restless.
Yes. So basically what we're saying is that the checklist approach doesn't work. You can't just check off symptoms, all that means it's ADHD. We also need to look at what's underlying and what are some other possibilities that could be resulting in that same presentation.
Correct. Sometimes there could be co-occurring depression or anxiety that may actually make the symptoms worse. Sometimes there could also be vitamin deficiencies. For example, I saw a kid with iron deficiency because he was not eating enough meat. And then he presented with very, the inattentive symptoms of ADHD, very tired, unable to focus, easily distracted. Some vitamin deficiency can actually cause the same symptoms as well.
Yeah, and that will clearly have a huge impact on the treatment, right? Because one will be just, addressing the deficiency and the other one will be stimulant medication. Yeah. I'm curious because we also see a lot of kids with ADHD who have sleep issues. There's a big correlation and link there. How do you tease apart whether, is it a co-occurring sleep issue or is the sleep resulting in the ADHD symptoms?
Actually, a lot of kids, I think up to 50% of kids with ADHD do experience sleep problems.
That's right, yes.
And usually I find that it actually happens more in the older kids, like those maybe peripubertal or post-pubertal. Younger children tend to be generally okay. Some of them may present with bedtime resistance. So because of the ADHD, they want to play.
FOMO.
They procrastinate their sleep and then they don't want to go to bed.
Or they're up late doing their homework because, they've been procrastinating.
So that is one problem that they may have because of the ADHD itself. But sometimes the ADHD, it can affect certain parts of the brain that actually regulate sleep. So for these individuals, sometimes they may find themselves having more restless sleep. So they may wake up more frequently in the night or they may have delayed sleep. So delayed sleep in the sense that they tend to sleep late and then wake up late. And then a lot of times I see parents complaining that they're not sleeping early because they're on the phone and they're not waking up the next morning. But it could be due to the ADHD itself.
Exactly. So clinically, I think a lot of the youths tell us things like they're lying in bed, but the brain is still, they have lots of thoughts racing through their mind and they find it really hard to relax enough to sleep well.
So we definitely need to ask very, very specific questions about what they are struggling with,
Yes.
and, offer appropriate advice.
Yes. So
Yeah.
that's why the interviewing is important, parents, when we ask parents questions, when we
Yes.
ask to speak to the teachers, is really because the process of diagnosing ADHD requires all this information, so that we can really understand what's going on and what's resulting in those symptoms. Yeah.
And sleep is very important as well, because with adequate sleep, then the treatment will be effective, right?
Yeah, exactly.
Yeah, if you don't sleep, then it's not going to work.
That's right. So are there like common misconceptions that you have come across about, ADHD, or questions that parents ask you?
I think the most common one is parents say that they're lazy, right?
Oh, yeah.
Very lazy, lack of motivation, lack of willpower, cannot do anything. But actually that's not true, because it's part of the ADHD itself, and they probably need some help in that aspect.
Yeah,
Yeah.
exactly. And a lot of times they'll say like, well, it depends on what they're interested in. Now, if they're interested in something, yes, they'll do it. It's like the interest-based nervous system idea, right? But if they're not, which is usually homework, schoolwork, and so on, it's really hard to get them to.
So that's what they struggle with. I think that's the most common one that I hear. Sometimes people say that maybe it could be their diet, or like, poor parenting, that kind of thing. But I would say that sometimes it's not really anyone's fault. It could just be the condition itself that needs to be treated.
Yeah, exactly. Yeah. Okay, we talked a bit about sleep issues and so on, that being very common among children with ADHD, and also it's something that you need to rule out when diagnosing.
Yes.
Maybe you can share with us a bit about your experience in managing these sleep issues, and what are some interventions?
Okay, so I think the main thing is to rule out any medical conditions that could be affecting their sleep, as I mentioned before. So any sleep disordered breathing, any allergies that we need to treat first. I think the other thing that is very important, for everyone actually, not only for kids with ADHD, is sleep hygiene. Having a good routine, bedtime routine, to kind of ease them into bed, right? So I think that's the most important part. Something else that we can consider, sometimes it could be the stimulants that actually cause the kids to actually sleep later. Because of the timing, sometimes they wake up late and then they take the stimulants late, and then it kind of drags on to bedtime. So that's one thing that we need to consider. The other possibility is that sometimes, because the medications wear out before sleep, right? And so they tend to have a lot of racing thoughts before sleep, and sometimes treating with stimulants before bedtime may actually help.
Oh, I see. So that's a little bit counterintuitive, right? Because when we talk about stimulant medication, I think a lot of parents see it as, stimulating the brain, but actually it could help to ease the ADHD symptoms so that they can actually sleep better.
Yep.
So that would really depend on the individual. Like, would there be a medication trial and then monitoring to see what works?
Yeah, so usually we will kind of monitor. I generally don't try to give the medications at night, because I believe in behavior modifications and sleep hygiene. But usually we potentially give a small dose of stimulants to kind of help ease them in. Sometimes melatonin does help as well. Actually, to help for especially those with people with intermittent awakening, or frequent awakenings at night.
Right. What about very young children? And I'm talking about maybe the below 5s. Is there anything that would, because I do have, parents who come in and their child is not sleeping, and so they are not sleeping, and it can be a very, very stressful kind of situation. And is melatonin recommended for that age group, or what? Would it be really the sleep hygiene would be the main weapon that...
I will go with sleep hygiene first, because there's not much evidence on melatonin in young children.
I see.
But, I would say that it is better to kind of have a good routine rather than rely on external sources to actually help induce sleep.
Yes, definitely. Okay, so Shihui, in your opinion, right, what do you think are the best available treatment options for ADHD currently?
I think that it would be a multimodal approach. So I always recommend patients going for ADHD coaching or therapy, because that kind of sets their day in order. They can learn how to schedule, they know their strengths and limitations, and they know how to plan their lives. And on my end, what I do is that I will see, according to their schedule, what are the possible medications that I can give to fit their schedule. So be it if they need to go to school, for example, is it something that I give them a longer acting stimulant so that they can help focus in school? Or if it's a behavioral problem, for example, disturbing the siblings at home, then they need something even longer acting or only in the home setting itself.
Yeah, that's right. So, sometimes I tell parents, that pills don't teach skills, lah.
It's
so
true.
so we tell them medication can be really helpful. And we've seen the effects in some of our clients as well, pre and post, and really see that, some of them say things like, they finally know what it feels like to focus.
Yeah.
That it is like a switch turn on, and it actually makes therapy more effective.
Yes,
right?
for sure.
Yes.
I do recommend that they take medications before therapy as well.
That's right. Yeah. So the combination is really effective. But at the end of the day, relying solely on medication, the child may not miraculously learn how to plan, organize and things like that. So we still need to teach the skills, lah. So
absolutely. It's true. What I always tell my patients is that, you can have no motivation. I can't give you a pill to give you motivation, You need to pair it with like some activities to get you out in the first place.
Exactly, yeah. So, for many parents, especially if their child is still young, I guess medication is often not the first option, right? So they often prefer to try other things first. So maybe I thought we could share a little bit about the side effects. So the common questions we get is like, my child will become like a zombie, or I heard so-and-so's child became like a zombie.
There's too much information online.
Correct. So it's scary, right? So maybe we can give them, the actual, the reality of taking medications, and what are some of the common side effects that you see?
The most common side effect would be loss of appetite. So sometimes what we would recommend parents is that eat a good breakfast, take the medications, and then go to school, and then we have a good dinner. So I think that is the common one that we can commonly mitigate. Some individuals may complain of stomach aches or headaches, but these usually go away with time. And if this persists with stimulants, for example, sometimes by changing the type of stimulants or changing to a non-stimulant option, that would actually help.
Right.
And as you mentioned, the zombie-like, or sometimes parents mention that they're spacey, right? A lot of times it could be over-medication, I feel. So when they are over-medicated, sometimes they may hyper-focus. And we can just reduce the dose of the medications, and that would actually help.
Right.
I've got a lot of kids teenagers especially, who don't like the medications because they feel like it changes their personality. Like, especially those who are hyperactive, right? So they feel like they suddenly quieten down and they're not comfortable
They're
with
not themselves anymore in a way, right? Because they're used to being that personality.
Yes. So sometimes they may be uncomfortable with it, or parents will be like, oh no, what happened to my child? So these are some of the common things that we see. So what I do sometimes is to slowly build up the dose of the medication, so that, they can still feel a little bit of themselves, but it actually helps them get through the day a little bit more easily.
Yes. What about the frequency of dosage? Because again, I hear from some of my clients where they only take it on a needs basis, like exams are coming and they take it, and then some of them feel that, they need to, or they're told that, it needs to be taken quite regularly for you to see an effect. What is your advice on that?
I think there are two different types of treatment for ADHD, right? One are the stimulants, which are taken on a when necessary basis. Then the other are the non-stimulants that need to be taken every day for it to be effective. So I think that what you're referring to mainly are stimulants, right?
Okay.
So I would say that it actually depends on the needs of the individual. So for example, if a child only has difficulties in school or academically, so they can just take it for school, right? And on weekends when they are playing, they may not need it.
Right.
But conversely, for someone who actually has emotional dysregulation or very, very, very mischievous, they may need to take it every day, even during holidays, to control the behavior.
Exactly, because ADHD impacts not just academics and learning, it can also have an impact on social skills. We see children with ADHD who are rejected by their peers because of,
or even siblings.
Exactly, so that might be needed in those instances.
Yes.
Sometimes we hear our parents talking about ADHD, the medication crash.
Yes.
Like where, when they stop suddenly and they feel, is there a basis to that?
Yeah, so basically, the stimulants have different durations of action. So between 4 to 12 hours, right? So as the medications come down, you may find that the ADHD symptoms actually come back, and you may have a rebound of these symptoms. So they may be more hyperactive, more irritable, more talkative than they usually are.
I see.
But this usually lasts around 30 to 60 minutes. It should wear off. But I do see in a lot of clients that sometimes this is the time where meltdowns happen and when things happen at home. So sometimes we may have to tweak the duration of action of the medication. So maybe switch to a longer acting one or switch to a different type of medications.
I see. What would you say to parents who are concerned, like, oh, will my child be dependent for life? Once he starts, he won't be able to stop, and then it will be a lifelong kind of depending on the medication?
I would say that no, you probably wouldn't need the medications forever. I think that what I usually tell the parents that I see are that they may need it during their formal education. So maybe up till tertiary education when they are forced to study things that they don't like, right? But once you go into university or, polytechnic, you choose something that you enjoy. So that's where the hyper-focus may come in, for example. So they may not need medications for that. Sometimes they may have learned skills on how to life hack, their way through the ADHD. So they may need it less.
Yes.
So there may come a point where they may still need the medications, but only on a when needed basis. Like on certain days where they need to do certain tasks that they don't enjoy.
Yeah, that's right. That's what I hear. I mean, I have adult friends who are on ADHD medication and they take it like when they're rushing a project.
Pay bills.
Yes, doing taxes, things like that. Right? But otherwise, if you find a job that is really suited to the way that your brain functions, then you shouldn't have to depend on it on a daily basis.
Yeah, so I
situation.
don't think it's going to be a lifelong thing, to be honest. Yeah.
Okay, great. Yeah. So what do you personally find most challenging about treating children and youth with ADHD?
I think the most challenging thing for me is the lack of awareness. Because some of these youth or children who come to me, right, they feel like there's nothing wrong with their lives and they don't understand why parents are complaining about them, teachers are complaining about them. And sometimes even when we present like, you're not doing that well in school, teacher complain, and they still don't get it. So under such circumstances, it's kind of difficult to get them to receive the treatment that they need or even accept the treatment that they need.
Yeah.
So I think that's the main thing. The other thing that I really look out for in youth is that because they're growing, trying to gain more independence and autonomy, right? So sometimes they may be a little bit more oppositional, more rebellious, and sometimes because of the ADHD itself, they may engage in more risk-taking behaviors that I'm really worried about. So I think the most common one would be vaping, right, in Singapore.
Yes.
So that's something that we're worried about. The other things would be like medication compliance, because that may actually because that may actually be less now that parents are not really that closely following up with them.
That's right. Yes. Okay. So in terms of let's talk a bit about the secondary impact of ADHD, because we also see that ADHD could, result in certain mental health conditions as well.
Sure.
Yeah. So what are some of the common, things that you see?
The common ones would be anxiety and depression. Sometimes it could be because of their struggles, coping with life in general. Like for kids in school, they can work very hard in school, but their grades are never good enough, or they feel that parents are never happy with them for whatever things, or even blame them for some of the mistakes that they do, which is not really out of their own volition. So I think that is one of the most common things. And previously I mentioned girls with ADHD. A lot of them do get overwhelmed easily, with life in general, right? Juggling so many things. Like now kids in school, they have CCA, they have tuition, they have a lot of extracurricular activities, and they find it overwhelming, even though they seemingly have it together. And this can actually lead to anxiety and depression. And not to mention the social relationships that you mentioned earlier, it may lead them to friendship issues. Sometimes with the ADHD, they may have some regrettable social media use that can actually impact on their mood and anxiety as well.
Yes, yeah, definitely. So are there ways to actually help to mitigate or to prevent some of the onset of secondary mental health conditions among the population with ADHD?
I think number one is awareness, right? I think we need to be aware that these are the potential conditions that can happen with ADHD. And so if we monitor these kids a little bit more closely and give them the adequate support, I think that's the main thing that we can help them with.
Yes.
The other thing is that maybe we can reduce their workload or make it into manageable bite-sized portions for them. Because sometimes if you give it to them in one huge chunk, they may find it very difficult and then they get depressed or, they get anxious doing it.
Yeah, absolutely. So it's about the match between the amount of challenge that they're having. When it outstrips their ability to cope, that's where you increase the risk of all these secondary conditions setting in.
Yeah, correct.
Right?
But I would imagine that it's difficult for parents to gauge as well because there's always a fine balance to tread.
Exactly. And there are kids where I know there's this myth of the tiger mom and, yes, there are parents who are maybe, pressure their kids a bit more. But personally, I see a lot of parents in my practice who are quite chill, they're telling their kids, don't stress, it's okay, we don't really care about, you don't have to be a top student, we just want you to be happy. But we see children putting a lot of pressure on themselves.
Yes.
Right, you see that?
I see a lot of that. So
yes.
It feels like if the parents don't put pressure on them, they put pressure on themselves instead.
That's right. Yeah. So that's where I guess therapy comes in, some of the cognitive reframing that we need to help them to do, the perfectionism and so on. Okay. So maybe we'll end with, some general advice, to parents where maybe they're struggling to support their child or teen with ADHD. What would you say to these parents?
I think there are lots of advice going online, like, be consistent, give your kids a routine, be supportive. But I would say that the first thing that parents should do is self-care. They need to take good care of themselves. They need to make sure that their cup is full, and then they can support their child with ADHD.
Yeah.
Because that sometimes can be quite challenging. So they need to make sure that they're in a good frame of mind the whole time. Because sometimes I do see a lot of parents who kind of get upset, and then they kind of scream at the kid, and then the kid kind of gets upset as well. And then, it just becomes very unhappy at home.
That's right. Yeah. And I think, the good thing is now locally we do have support groups like Spark and things like that parents could go to. So definitely, self-care, I think, is one of the key predictors also. And that is why, how with the younger children, actually the first line of intervention for ADHD is parent training.
Yeah.
That's right. And then, sometimes it's a little bit hard because the parent is like, well, is there something wrong with me then? No, we're not saying that there's something wrong with the parent, but it's because we realize, we recognize that having a child with ADHD is not an easy task, it is pretty challenging. And so that's where you need to maybe get some support, get some training and so on. So it's not that you're a bad parent or it's poor parenting. Poor parenting doesn't cause ADHD, but definitely if you're a child with ADHD, then the bar is set a lot higher. You have to be a lot more consistent, you have to have clear expectations and things like that.
And a lot of patience.
Exactly, yeah.
But the other thing is that, there's a high heritability for ADHD as well, right? It's 60 to 90%. So there could be a chance that the parent may be struggling with some of the symptoms themselves, or that parent may have a spouse who may have ADHD, and that's why struggling with all the individuals in the household.
Completely.
So that's something that we probably need to look out for, and if needed, maybe seek help for that.
That's right, yeah. I don't know whether you have this situation, but very often when we assess the child and we share the diagnosis with the parent, they'll look at each other and we know where that comes from. We just knowing. Yeah. But I would say, it is good in a way because it allows the parent to really understand when they can really identify, say, I actually went through a very similar path as my child. And that allows you to have that empathy and the understanding for your child also. And, when we say go for ADHD coaching, like what you say, where parents who say that, hey, actually, I need this too. This is really helpful for me as well, learning how to organize and schedule things and so on. Yeah. Okay, we've got to the end. And thank you so much, Shui. It was really good and interesting. And I hope that, our viewers have also found that helpful. If you've got any other questions for Dr. Poon, please feel free to put it down in the comments below. Thanks for watching. Goodbye.